All right, so in this recording, we're going to look at a few muscles, four in particular, that are known as muscles of mastication. And the term mastication is referring to chewing. So these are our muscles of chewing. Muscles of chewing whenever we are eating, whenever we are moving our mandible. So even if we're not actually eating or actually chewing something, if we're moving our mandible up and down, like if you're clenching your teeth and whatnot, you can actually feel these muscles contracting very easily. Okay, so the first one and the most obvious one that we can generally see is this muscle here known as the temporalis. Okay, so if you recall from anatomical regions, this region of the head and of the skull is the temporal region, right? We have the temporal bone under here. We have the temporal lobe of the brain, and so this muscle is aptly named the temporalis. Okay, this is one of our muscles of mastication. Excuse me. It is the largest muscle of mastication as well. Okay, it attaches along this superior aspect up here that's highlighted in blue that you can see. This is kind of the temporal fossa. So this large region up here on the lateral aspect of the skull, and then it travels inferiorly, and it here I'm going to hide this muscle here so maybe you can see it a little bit better, and then it attaches to this region here known as the coronoid process of the mandible. So right here at this inferior aspect where you see this blue ending, that is the coronoid process of the mandible. So as this muscle contracts, it is going to do a couple of things. One, it is going to elevate the mandible, so it's going to pull the mandible up as if we were closing our mouth. It is also going to retract the mandible, so as if we were pulling our jaw backwards. So you can stick your jaw out and give yourself an underbite, and then whenever your jaw comes back to normal, that is retraction of the mandible, and that is also being accomplished by this temporalis muscle here. Okay, so after I go through all these muscles, I'm going to show you some of these action animations that will make some of these movements make a little bit more sense. Okay, so that is our temporalis muscle. Now, for our temporalis muscle, our masseter muscle, and what we're going to call our pterygoid muscles, these are all muscles of facial expression that we said. These are all innervated by a common nerve, just like we had a common nerve innervate our facial expression muscles that we mentioned earlier. So all of these muscles that are involved in chewing, mastication, moving the jaw are going to be innervated by our fifth cranial nerve known as our trigeminal nerve. Okay, specifically one of the divisions of the trigeminal nerve. So trigeminal, you may hear the term tri, so there's three divisions. One of those divisions is known as the mandibular division, and that mandibular division is innervating all of these muscles of mastication. Okay, so keep that in mind as we're moving forward. So this is our first one, our temporalis. So if we rotate our skull over, we can see this muscle here. So it has this superficial head and it has this deeper head. But this whole muscle together is known as the masseter muscle. Okay, so the masseter muscle is also going to be involved here, and you can see it here. It's going to be involved in elevating, so closing our jaw, closing our mandible, also protraction of the mandible as well. So protraction of the mandible means it is going to be protruding the mandible outward. So as if you were giving yourself an underbite, you're sticking your jaw more forward, more anterior. This muscle is largely responsible for that. So it's attached up to our zygomatic bone and part of our temporal bone, and then down here along the inferior aspect of our mandible near the ramus and the angle, and is helping to move our jaw. So this temporalis muscle and this masseter muscle, both these heads, we'll do the temporalis muscle first. So if you put your hands on your temporal region and you clench your teeth, you should be able to feel that muscle contracting and bulging out as you clench your teeth, as you kind of bite down hard. Okay, now don't bite down too hard, but as you bite down, you should be able to feel that muscle kind of protruding out. All right, so again, as we're clenching our teeth, that's as if we were elevating or closing our jaw. That muscle is contracting. Likewise, you can put your hands on the side of your jaw, on the side of your mandible, kind of in your cheek region, just kind of posterior, and again, clench your teeth. As you clench your teeth, you should be able to feel that muscle bulging out, as if whenever we are closing our jaw, we're elevating our mandible, that muscle is going to be contracting, and it is going to be moving the mandible so as to close it and allow for this chewing motion that we'll see. Okay. All right. So if we rotate back around, we can see a few deep muscles deep to our mandible. So really the best way to see this is to actually remove our mandible. So if we take this and we fade it, you can kind of see through it, And you can see some of these muscles located deeply in here, all right? So if I go ahead and remove the mandible, you can see these more deeply located muscles. So I'm going to get rid of some of this connective tissue here. But what we see is we see this muscle here, and we see these two smaller muscles just superior to that. So these are known as our pterygoid muscles, okay, pterygoid. There's a medial pterygoid and there's a lateral pterygoid. And these are going to also be involved in moving our mandible up, so elevating it. They're going to be involved in moving our mandible forward and backward, so protraction and retraction as well. So if we add our mandible back, you can kind of see how these muscles are going to be attached to the inside of the mandible, right? So if we rotate this around, here you can see this medial pterygoid attached to the inside of the mandible, and where it's attached to anteriorly are these pterygoid plates, okay? And these pterygoid plates are part of our sphenoid bone, okay? You can then see these lateral pterygoid muscles that attach again to our sphenoid bone and pterygoid plates, but they attach backwards or more posteriorly to our mandibular condyle, all right? And as these are contracting, they're going to draw the mandible forward, so maybe for protraction, and they can also help with the opening and closing of the mandible as well. Okay, so what I'm going to show you here, and again, remember, all these muscles are innervated by our trigeminal nerve, that mandibular division. So if we look here, we can see some nice animations of some jaw movement. So this here is showing our lateral pterygoids. So you can see here, as it's contracting, it was moving that mandible forward. So here it goes again. Those muscles are contracting, pulling on the mandibular condyle, and protracting the mandible. In other words, pushing the mandible anteriorly more outward, okay? So again, if we rotate around, you can see that happening as it is attached to that mandibular condyle, all right? You can also see mandibular depression, okay? So mandibular depression meaning we're closing our jaw, okay? So don't pay attention to this muscle here. We'll talk about this posterior one maybe another time. But here you can also see our lateral pterygoids pulling on our on that mandibular condyle and pulling it down so as to depress the mandible, okay? All right, you can also see mandibular elevation. So in other words, we're closing our mandible, right? We're closing our jaw. And this is accomplished by three muscles, our temporalis, our masseter, and then if we rotate internally, we can see our medial pterygoid here. So again, as all of these muscles are contracting, they're pulling the jaw, or they're pulling the mandible superiorly, they're closing it so as to close the mouth during chewing. So again, these are the muscles here, this temporalis here and this masseter here. Whenever you open your jaw and then you go to close it, and then once it's closed, you clench your teeth, you should feel both of those muscles, this temporalis and the masseter muscle, contracting, okay? So again, we are going from an open state, and we are going, and we are closing, and you can see that muscle, you can really see the temporalis muscle, but the masseter as well, contracting those fibers, elevating the mandible, and closing it very nicely, okay? So we will stop there with this video of muscles of mastication, and we will pick up by talking about a few muscles that move our neck, and then we will get into some thoracic and some upper limb muscles.